we are taking the step to return to essential visits only in all our hospitals. This decision has not been taken lightly and is to keep our patients, who are your loved ones, their visitors and our staff, as safe as possible against a backdrop of COVID-19 transmission in our communities across Ayrshire and the Central Belt. We will keep this under review with the help from our public health team. Essential visits by a maximum of one visitor will be supported in the following circumstances. To accompany a patient to a critical appointment where they will need the support of a loved one. For patients who are distressed and suffering from delirium, dementia, or have a learning disability and they are in a distressed state, this may apply in other conditions and will be at the discretion of staff in collaboration with families. For patients with a mental health diagnosis, visiting will be considered an essential as part of their care, and particularly where visits not being permitted would cause an additional significant level of distress to the patient. Children under the age of 18 will still be permitted to visit a parent. For our maternity services, women attending for antenatal appointments can be accompanied by one visitor for support, and this includes all your ultrasound scan appointments. For labour and birth, women can be accompanied by one birthing partner whilst they're on the labour or midwifery suite. During postnatal inpatient stays, women can also have one visitor for a pre-booked 30-minute essential visit. For our neonatal unit, babies can continue to be visited by one parent at any time, and if both parents wish to visit, this can be arranged as an hour-long appointment. At this time, unfortunately, we are not permitting children to visit our inpatient areas in an Ayrshire maternity unit. For end-of-life care, visits will be supported for a maximum of 2 visitors. These will be agreed with the family and the clinical team depending on the patient's condition and what together you think will benefit the patient most at this important time. Please visit our website for all the details on what constitutes an essential visit. On our website, you will also find guidance on what you need to do to keep yourself and your loved ones safe if you are making an essential visit. You need to wear a face covering. You need to follow hand hygiene instructions and observe social distancing at all times. Staff will be there to guide you. If you have any COVID-19 symptoms, such as a new and persistent cough, a fever or high temperature, loss or change in your sense of taste or smell, it is really important that you do not visit and call 111 to seek a test. Thank you. We know that these restrictions will be hard for patients and their families, and I want to thank everyone for their patience and support as our staff continue to work incredibly hard to provide care for residents of Ayrshire and Arran. Remember that where face-to-face visiting is not possible, virtual visiting is also an option and staff can support this. Please just ask. Thank you for your help.